Hey, so I think at this point, you all probably know myself, Mike, and Lowell, so we're probably going to get right down to it because, as Charlie said, for the flow of these sessions, really our hope is to give you some education, help you wrap your mind around what's coming, and then show you really how Charlie, Jill, and others have set up a relationship with our companies to help you once these things really start coming into effect. So that's going to be the flow. I'm going to talk about some of the rules, the background of testing relative to the requirement that will be coming for you all to test schools and childcare facilities for lead in drinking water. We decided to make it its own topic because that's real new. No one's asked you to go into a school or a daycare before to do this. You provided them with water, you've been doing it for a long time, but there's some tricky nuances to it. And Mike and I are going to talk about those things, obviously, Mike, relative to comms. So popping into it, you've been on some Zoom meetings before, but we like your feedback. So use either the chat or the Q&A. If you want to talk to each other about what we're saying, agree, disagree, ask some questions of each other, use the chat maybe. Highly encourage that. And then for Q&As, if you want to go the official route, go ahead and submit it that way. And Lowell's going to help us at the end get some of the questions out. All right, Mike, let's tell the folks who we are just one more time. We'll make it quick. Erica Walker, 120Water, Senior Director of Services. I'm in the consulting arm of the company. I'll tell you something new about me since you've been here. Uh-oh. Someone's doing some art in my face. It's very entertaining. But I'll tell you something new about me. So you knew I was an environmental scientist and that my company, 120Water, has been helping communities in 23 states find and get rid of lead in drinking water. But one of my passion areas for the last 6 years has been school and daycare water quality. And before coming to this company, I was with the state of Indiana, and we oversaw, it was a testing project of over 1,000 schools in the entire state. My job was to help them figure out how to test and then to help them figure out what the heck to do when the results came in. What do these mean? How can you actually act on these? And I'll say shades of what I did will now be on your plate. And so I'm really excited to sort of talk with you about that. And then, as I said, Lowell, our company, we've geared up to do this work. We've been supporting utilities and states already in testing. And so we're super prepared to help you and excited when that time comes. Lowell, or excuse me, Mike.
It's Monday. Everyone, I've talked to him several times, Mike McGill, Water PIO. We help utilities of all sizes affordably improve their customer immediate and crisis comms. Today is going to be a difficult topic when it comes to the communications challenges you face. So I won't say much more to give us a little extra time. We're at waterpio.com and my Twitter handle's waterpio. And I appreciate the outreach. I've gotten outreach from a few members who have sat in on these conferences talking about the future. So I appreciate that. And with that, I'll let you get rolling, Erica.
All right, let's keep it moving. Here's what we're going to cover, guys. So I kind of want to talk about why are they asking you to do this in the first place? So we're going to do a little bit of the background here. Then we'll talk about, where are we expecting to find lead in these facilities? A little different here than lead service lines, which we've been discussing. I'll hit you with a couple slides on what they're asking you to do. Mike's going to talk about the comms sort of specific aspects of working with this community. It's a little bit different, a little bit new. And then Lowell will talk about, sorry, Lowell, I never give you a bullet, but you will talk about how we can help you, help this community, and then we'll get into some questions and discussion. Before I move on to this next slide, an important preface here. You're not going to hear me ask you to start testing these facilities this year. That's not what we're saying here. Mike and I have talked this before. Important for you to make plans and readiness across all these provisions for you to understand it. Important for you, in my view, to start your inventory as soon as possible. But I've got a couple of emails from you all, and I love how engaged that you've been. Nobody's saying you need to go out this year and start testing. The testing part does not come into effect until sometime in 2024. There are some things you can do today, and we'll talk about that, but I'm just going to start there because y'all are busy and we're not trying to throw this on your plate yet, the testing part at least. All right. Why are they doing this? You've heard this before. Lead is one of the most widely studied and understood contaminants in environmental history. We haven't found a level that's safe for adults or children. It's not good for either of us. It's a neurotoxin, so it can impair physical and mental development. IQ points in Flint, Michigan, sadly, in the years after the water crisis there, they saw a significant drop in IQ points in children there. So these risks they're real. There is a lot of hype in the media about this issue. And sometimes, we look around at all the needs in our industry and we say, is lead really the greatest need? Why is there such a disproportionate effect? But I will say, when you come back to it, there are real health threats at play here. So that's really one of the primary backdrops. In addition to all that well-known stuff about health, EPA has its own things that it would add to that. And I mean, certainly health is a big priority for EPA, but as well, children they spend a lot of their time in these facilities, in schools and daycares. I mean, for some of them, it's 60-75% of their life are in these facilities. And so they get drinking water. You are providing their primary drinking water sources, well, everywhere, but especially in these facilities. A lot of them are untested. The Government Accountability Office put out a report, I don't know, I think 4 years ago, and they found out that over half of the schools and daycares in the country had just never been tested for lead. I mean, let alone really anything else, right? It's once the water gets into the building, it's a bit of a black box in there. So EPA recognizes this and thinks that you all are uniquely positioned because of your relationships and expertise to come in and help them understand what water quality looks like in the building. Their other thought here is that it could help you. You all know about water chemistry. Water chemistry in these buildings is so much different than in someone's house. Water sits a lot longer. It's interacting with all kinds of plumbing materials. And so EPA's thought here is that it can provide you all with some additional information about how your corrosion control is working in these big facilities. So this is what they've said. Where do we expect to find lead in these buildings? So we've talked a lot about service lines. I'll make this relevant to something I keep harping on, the inventory. Do an inventory, start your inventory today. You would have to include a school on your inventory because EPA has said you need to ID every single service line in your service area. So it's interesting. I mean, there's a little bit of a connection here. You're going to have to map out the service connections for all your daycares and your schools. But usually you don't expect to see lead pipes in larger buildings. It's a soft metal. And so very uncommon for it to be in a large distribution pipe like you would expect in the lateral connection or the service connection in a school or daycare. I've seen it, not common. Instead, it's really inside the building. It's stuff that the schools purchased, that the daycares purchased, and they didn't know it was lead. And in fact, up until 2014, so-called lead-free plumbing could contain 8% lead. So a school could have gone out and said, I'm going to buy a bunch of brand new water coolers and Y valves and all kinds of things inside their facility. And they bought lead and put it in there. They just didn't know. So, both of you all, I think, are in some respects, you're a little bit victims of an unregulated plumbing market. You use things that you didn't know at the time would be harmful for human health, and now they've been stashed in here, and you're asking to help clean it up effectively. I think that's kind of important to say. So sources and sinks of lead is how I kind of break it down. So you got regular sources, like I talked about, lead solder, brass, leaded brass is very common all throughout schools, lead solder lines, lead service lines, and then sinks, places that will collect the lead from those parts, and it will hold it, and like a tea bag in water, lead will slowly be leached out of that fixture. In general, I talked about our experience here with this kind of testing, and I just break it down into maybe 7 key steps that you would think about if you're trying to go out and help these facilities figure out where their sources of lead are, which is it's not usually a corrosion control thing. It's the testing is a tool to help the utility narrow down where all those sources and sinks might be. A little different for you, and we'll talk about that, but generally this is how you approach it. So, Mike's going to talk about this. There is a need to do some additional kind of upfront comms, right? Never talked to these folks about water quality before. They're really not thinking about it. They're thinking about getting the school buses in on time. They're putting out a million fires just like you all. Some of them are coaching the basketball team, whatever else they have to do at that facility. And in rural communities, these folks do it all. I mean, truly. So you're reaching out to them, you're telling them why you're doing this, how does it work? You're helping them identify where to sample. You're figuring out who's going to do the sampling. As we'll talk about with the rule, you could go in and do it, or you could have them do it. So you could educate them to do it and take the samples. And my company, at least, we've had a lot of success with schools actually taking their own samples, because it's not rocket science to put a bottle under a faucet and pull it out. They don't need a chemistry degree. They don't need to be a certified operator to do that work. They can work with you. And so if whoever's doing it needs to be educated on how to do it, you got to work with the lab. You got to have the right supplies. We'll talk about how we do those things. Then there's some responsibility to go out and share the results and to educate the facility on what you found. And then, you got to be prepared to provide guidance. And EPA has, we'll talk about it in a minute, but these are essentially the things that they've recommended, but this is just the flow of how it would play out in your life if you were to go out and work with these facilities. So let's talk about specifically what they're asking you to do. So they want you to sample all elementary schools, public or private, and regulated childcare facilities in your service area. They just want you to do it one time, mandatory, one time. And they would like you to do it at a rate of 20% per year. So for some of you all, you may only have 1 or 2 of these facilities in your service area. So you could just, 2024 comes around and, depending on some of those timeline finalities, which Charlie mentioned, there are some fluctuations happening in the rule, but you could knock it out in the first year, or you could spread it out over those 5 years and sample. All non-elementary schools would now be by request. So if you were sampling a elementary school in the same district and the PTA called the school and said, why aren't you sampling the middle school? They could call you and say, hey, could you add this? And you would need to do those other facilities. But EPA is focusing on young children because we talked about the effects there. You've got a hey Zeb, can you go on mute? Zeb Brian. So you gotta also share your results with the facilities, the health department, and then your state regulator. Luckily, your state regulator is very collaborative. I actually spoke with them last week, and they want to help you, and they will be helping you. That's the attitude that they have, really, as a collaborator with you. So you got to share it with everybody. And something really important to note here is that these results don't go into your 90th percentile calculations. They're totally separate. It's still the tier sites that do that. And so Lowell and Mike and I, in the next session, we're going to be talking about how the tier sites are changing and what would happen now with some of these action and trigger levels. So this is completely separate from that, and you don't have to think about these results for tier site level standard compliance. When do you got to do this stuff? 2024 TBD. We've got the Biden administration. Actually, on Wednesday, I'm going to be participating in some listening sessions that they're doing. They're going out and they're getting some more feedback from the community, mostly those most impacted by lead. But we're going to be talking about, really some of the challenges that we see the rule in general, inclusive of childcare testing for state agencies and for you all. And so, we expect in the next month or so for them to tidy those things up, and we'll be able to put something else besides 2024, hopefully not TBD. As I mentioned, 20% per year, you could do it that way in terms of how you knock out the sampling. And then all sampling would be by request after that. So after the 5 years, someone could call you up and say, hey, I got a call from a parent or something. Can you please come back and test? And you would have to go out and do it again. Waivers are possible. And in your state, you don't have regulations for both schools and daycares in terms of mandated testing, but you do have, the state is doing some great work through an EPA grant. And at least right now, it's kind of uncertain whether or not that would apply for a waiver. It's not looking like it would, but it's possible. And again, DHEC, they're trying to do everything that they can do to take stuff off your plate. And so if they find out that this testing would count, then they'll let you know. And that may mean that some of the facilities in your service area wouldn't have to be sampled. So kind of wait to hear from them. Moving along, this is my only other slide on the requirements. But again, these two slides this is all about just giving you familiarity, giving you comfort with what's in the regulations related to schools and childcare testing. We talked about which schools, elementary, and then also the childcare facilities. And in both cases, I'll kind of sum them up because there's actually a lot of similar themes between these two types of buildings. But for both, you're focusing on those that were built before 2014, and that's because of the plumbing regulations I was talking about a minute ago. After 2014, the federal government started sort of tamping down the allowable lead concentrations in those plumbing parts. And so they're saying, hey, we think we got it with this new building, so let's go 2014 and below. For schools, it's public and private. Like I said, for childcare facilities, it's regulated childcare facilities. So you would need to think about like your state daycare licensing agency would have that information. In terms of how you're sampling, it's the same. You need some pre-stagnation, just like you do with your other lead and copper rule samples. But in this case, it's 8 to 18 hours is that window. They want it to sit in the plumbing. And they want to basically understand, like, what would it be like if a child walked up to that water cooler after a night off of school? What would that chemistry look like, and would lead leach out? In terms of where to sample, so they're not actually having you sample like every single fixture. They're wanting you to do just a handful. So at schools, it's a total of 5, and I've listed out some specific areas. You'll notice as you kind of look through these kitchens, drinking water faucets, nursing stations, these are places that kids go commonly for drinking water. They're not having you go in like the janitor's room closet. You know what I mean? This is to help you really help them understand, like, what's the average kid drinking in these buildings. And then for childcare facilities, it's just 2. And that'll be plenty for some. I mean, I've got a ton of daycares that are down the street from my house, and they're just someone's house, you know what I mean? So you're going up to someone's, it's almost like your normal tier sites that you might just be sampling from a regular kitchen faucet. But obviously in that case, you are talking about daycares, especially, you're talking about formula. So we could be looking at lots of water in those facilities.
Hey, Eric.
They would be drinking. Yep.
Vincent had a couple of questions. I just figured while we're doing this.
Oh, sure.
He asked, who pays for the requested samples at non-elementary schools? Is that going to be on the utility?
Yeah, that would be on the utility. Sorry about that. One of the things that I've been seeing out of Washington, there's some really fast moving infrastructure bills, and actually one just passed the Senate on Friday, and it had funds in it for school and childcare testing. And then Lowell and we work in well, I don't know, maybe it's like 7 states or something like that, that we're taking advantage of some EPA funding for schools testing. So I would say, yes, they're expecting you to foot the bill, but it does seem like reasonable to think that funding would be available to support you.
Yeah. And then he also said, I thought sampling was 1st and 5th liter. Does that not apply to schools and daycares? So obviously there's a bit of a nuance here with the 250 mils. Just wanted to make sure that we clarify that for him.
Yeah, actually, I'm glad you brought that up. I could see like maybe on the last presentation or Charlie, when we come back and we do one, maybe we do like a, here's a comparison of the different kinds of sampling you have to do, because it's true, there's like different bottles and it's all pretty complicated. But yeah, you're right. So 1st and 5th liter sampling is only at locations that either your records indicate are lead service lines or you've seen our lead service lines. So that's what that's for. And then 1 liter would still be your standard tier site, just like you've been doing this whole time. That's not changing if it's a non-service line served home. And then here it's 250 milliliter bottles. So they're introducing a new bottle. It's standard in our world to use 250 mils. It's something EPA has done. Their logic is that's closer to like what a child would drink. They drink less water than an adult. That's the thought, but there's some flaws with that in my opinion. Anything else, Lowell?
No, thank you. And thank you, Vincent.
Yeah, thanks, Vincent.
Erica, let me interject one thing on child facilities. Because one of the questions I had is what constitutes a child care facility as far as DHEC is concerned in EPA. If you go on the EPA on the DHEC website, there is a list of what they consider to be registered child care facilities. So those are the ones that qualify. So like Erica said, if there's one down the street where a grandmother's keeping 3 children or whatever, if they're not registered, you don't have to go sample them. It's only registered daycare facilities by the state of South Carolina. And that list is on the DHEC website. Unfortunately, it's by zip code and not by county. So like in Chesterfield County, we have, I think, 9 zip codes. So you have to go weed all those out. But anyway, that was a question that I've had several people ask, and hopefully that will clarify it somewhat.
Yeah, that's great. Thanks for sharing that, Charlie. Is there anything else, Lowell, that came in?
Yeah. If you have already tested a school or a daycare in the 5-year period and a parent or somebody wants to resample, you have to do a retest, correct? And if so, is there any idea how often that's going to need to occur? I think what Carl's asking is like, is there like a limit or an expectation level?
Yeah, it's a good question. As I read it, no, if you already sampled that particular, say it was an elementary school, you already sampled that elementary school within your 5-year period, you're not required to then resample by request that same facility. That's nowhere in the rule. I mean, you certainly could say, thanks for reaching out, really glad you're interested, let me direct you to someone else who can help you with testing. But no, I think that would be egregious. The other thing, the other thing is the limits. Yeah, the limits are, I think, pretty clear in terms of just get it done one time within that period, and then anything that wasn't required, those non-elementary schools, again, that would be another one time that you would have to by request. But that's something certainly that I'll jot down, and we can try to get some clarification. I will say, schools are not super pumped to do this kind of testing. I think you'll find. I mean, it just like for you all, this is a little bit of a distraction for them. And for them, they want to do the right thing. They're just like you. They want to make sure they're giving clean drinking water to folks. But it opens up a big old can of worms for them too, to have the administrations there to have to deal with questions from parents on this stuff. So I think it'll be pretty rare that the same facility, I've actually never heard of it, the same facility coming and saying, hey, can I get another retest? Unless they're being really aggressive and trying to fix the problem and they want to confirm that their work was successful. That's the only time I've seen it before. So, all right. So I was just gonna leave us off here, and actually Charlie set me up perfectly with his note from what DHEC's provided. But so here's what I would recommend that you can do in the next 1 to 2 years to prep for the changes. Do what Charlie said. Go on the DHEC website, pull those zip codes down, and just get a sense, how many of these things do you have? And do some quick math. Child cares times 2, schools times 5. That tells you how many places you have to sample, and that can give you just a kind of sense of how big is this? Am I talking about 2 spots, or am I talking about, do I have like 50 little daycares that are regulated that I didn't think about? So do that. That's the first thing you should do. There's this thing called 3 Ts. The 3 Ts. It's published by EPA. It's a free resource. So you might, over the next 1 to 2 years, kind of familiarize yourself with that. I would look out for notes from DHEC on applicability of testing that's already been done. They'll have some additional guidance for you there. As they continue to get, I mean, they're waiting on EPA in many instances themselves to get clarity on pieces. So they're kind of doing what they can, but as soon as they have anything finite, they would let you know if there's any waiver that would apply to your area. Same thing, they're going to have some additional guidance and educational materials for you, not going to leave you out there to dry. So look out for those things. And then I'm a big proponent of just using this time to plan. So definitely think about your plan of attack. If it's working with us, if it's doing it in-house, whatever you're doing, just make sure you've thought through, how are you going to do this testing? Do you have the supplies? Do you know where you have to go, et cetera? What's your comms plan? And with that, I will turn it over to Mike to talk about, speaking of comms, the comms related aspects.
Right. And thank you, Erica. I appreciate it. What I'm going to talk about today, this isn't going to be easy. And I think we all know why. When we're talking about kids and their health and protecting it, and a discovery of lead, that's about as hard as it can get for a water utility to explain, or a school system, or a daycare. So that's why I'm going to talk about today. Go ahead, Erica. Thank you. All right. Start off with my main point and how it attaches today. You've got to become and stay the go-to source for information about your work on the lead and copper rule. Talk early, often now. It's Drinking Water Week. I'm putting out posts all morning for clients on Drinking Water Week. These are opportunities that we have to speak about what we do. And when it comes to school and daycare testing, comms is going to be essential to survival, not just success, because all it takes is one bad situation with one school or one daycare in your system, and you've got a problem. And so you've got to focus on internal interagency communications as well as external communications on this topic. And I'm going to get into that in a second. Go ahead, Erica. All right, just the overview, and I cut this down a little bit from before. The big point we talk about: explain the rule and its challenges before they affect you. Don't run away from the rule. It's in place. It doesn't make sense to get defensive about it. Tackle it head on. Tell people how you've worked with it in the past, how you're going to work with it in the future, because timing is everything, especially on this issue of schools and daycares. You can say the exact same thing before an exceedance or discovery, and you look transparent, trustworthy, like you're on top of it. If you say the exact same things after an exceedance or a discovery, you look guilty, you look like you've hidden something, you look like you didn't help before, and that's when you get into trouble. We've talked about the rule, we're going to keep talking about it, the inventories, the testing, the trigger level, and the communications for a system-wide exceedance. All those challenges are in place with this rule. So you got to detail your hard work, how you set up, and how you're doing all the work now, and will do it in the future. And you got to get out front. This issue alone, you've got to prepare for. You can't just have something in your back pocket and throw it out there when you get stuck. You've got to actually prepare for this, because any discovery or exceedance or pointing of fingers can lead to accusations that you've harmed children. And that's as basic as it gets for a water utility. All right, so the challenges, the directive itself will draw attention. And you're going to have a process with some people that will be negative at the start. Why haven't you done this before? What do you mean you haven't been testing schools and daycares before? Because they won't know the public doesn't have a background on this. You know, why didn't you care? Have you been serving my kids lead all these years and we didn't know it? You know, those are some questions that people will jump to because no one, you know, there's a lack of trust in institutions right now. Process will take time to complete. As Erica talked about, you got to hit 1/5 of your daycares over 5 years. You know, for larger systems, this is a larger problem. There are just so many that are out there, but you've got to be on top of this. And it requires participation, and child cares might not be willing participants because you put their business at risk. The press and public, like I said, won't wait. You know, child cares, they get a finding, that stigma attaches to them, they can lose their entire business. So you're going to have conflict. The results will be passed around, in public records. Facilities, primary agencies, health departments, they're all going to get the info in addition to, you know, schools and daycares. So the word of the results will get around. That means they could become public. Anybody can make them public. An enterprising reporter can go in, file a FOIA, and find out the information. You've got to have interagency comms. And in this issue, you might not have them. You know, some utilities don't have strong relationships with their school systems, okay? And ideally, you have a good one with your health department, but I've seen relationships that are bad. You've got to boost them. You've got to improve them because everybody's at risk. It's almost like a mutual assured destruction. If everybody isn't on board, then everybody's at risk. And political motives can wipe out team efforts. If you've got an exceedance or discovery and a politician jumps on it and you're not prepared for it, you could be a target. And then you have the comms process itself for the child care facilities and moms in the media. Can't tell you how many times social media storms have risen because a group of moms in a service area have said, this is my topic. This is what I'm going to spend my life on. You can have the panic and anger whenever you got discovery. And dramatic stories, I was a news producer for a long time. They block out logical explanations. You get pressure from all sides. You know, it can fracture weak relationships. So you can't just roll the dice and say, gee, I think my relationship is good enough. You got to build them up. And blame games are possible. All right, part one of this, how you build and improve the interagency relationships. School systems and health departments, I'm going to focus on schools at the start here. They determine your success or failure here. Internal trust is essential. If you got gaps or weaknesses, now's the time to address them. You do have time on this to prepare. And if you don't prepare, then it's your fault if things fail in the future. And there's no chance to avoid the potential PR problems. You're going to have to inform as testing gets started and after the results. Throughout the entire process, there's going to be messages flying around. You've got to be on top of it. Develop your interagency approaches for your testing programs. As you conduct the tests or you teach the school systems to do their tests, you provide support. You know, you've got support from the school systems and health department. You're all in it together. Your comms plans and your actions plans. I talk about this, about the overall rule. It's the same thing here. You got to have an action plan in place if you have a discovery or an exceedance, and then you have to have a communications plan to go with it. It's not a 50-page plan. It sits on a shelf, you know, covered in dust in a binder. They all work together because you have to anticipate that findings will be made. You've got to get comms involved. It can't be an afterthought because you can have the best response possible. And if you don't know how to communicate that response, it'll look like the worst response possible. Develop your educational materials together. Co-brand, there's safety in numbers. If a message comes out from the water utility, school system, and the health department, it's 3 times stronger. All right. Get prepared, get proactive. The testing is going to be a constant concern. The earlier you get started with comms, the better. I'm not saying do it tomorrow, but start planning tomorrow. And then when problems arise, you're ready. You put out that plan, you've got speed and accuracy. I say this all the time. Accuracy is job 1 in a crisis. Speed is job 1A. If you're planned, you're going to be ready. Part 2, the external comms, okay? This is where you're going to have to boil down. I love SWOTs, strengths, weaknesses, opportunities, threats. You can get it done in a day. Be honest and talk about your community ties and your business relationships because they're going to be key here, especially with childcare facilities. If you know, same message here. Gaps or weaknesses, address them because now is the time. And there is no potential to avoid the PR problem. Improve or build your external comms about your current work. You build up that base of trust so you're ready to go with future issues. and make sure your operational plans have those comms plans. Like I said, with these issues with the public, anticipate findings. Build contacts with the school systems and make sure the school systems have contacts for you with PTAs or community groups, interested groups that protect children. You're going to want to bring them in. Chambers of Commerce can help with the daycare facilities and that business angle to make sure that everybody's on board. You want to bring them in, because if a Chamber of Commerce is shocked by a lead exceedance or a lead discovery, they're going to be your enemy pretty quick. And then the messaging and the co-branded materials. For schools, you work with the water and the school systems, child cares, the water system and the health department is a big key. I'll show that in a second. Once again, you lay out the challenges before they start and you co-brand. You focus on parental concerns. Oops, sorry, Erica. Or did it jump? Okay. Focus on parental concerns. That's your number one issue, because the parents are going to be the ones that are going to have a microphone in front of their face on camera. So make sure you focus on the messaging on the parents. They're going to want to ask, how did you harm my child? That's number one on your mind. So you're going to have to answer that right away, because that's what everybody's going to jump to. You are the experts. Here are the messages. This is what you do. In the instant information age, the public needs to hear from you. Some are angry, but most want reassurance that they're going to be okay. They don't want to run out and bottle water if they have to. They want to trust you. But Flint hurts us, okay? So you've got to emphasize this is not Flint, because they'll go straight there. All you got to do is punch it into Google, lead in drinking water. There it is. You've got to explain the difference between Flint and your situation. If you find a hit in the school, you've got to use your informed expert role. Show your work. If you show your work, people will trust you. If you don't show it, they won't. It's that simple. All right. And you talk about this school and daycare piece as being the next stage of your work. You are working to get the lead out. Okay. You want to get it out for good. There's an emphasis now to get it out for good. You're going to take the reins and get it out for good. You're going to work with school and business leaders to protect the kids. And then you talk about the hard work of your staff. All right. This doesn't happen if dedicated public servants don't jump on this like we are going to jump on this. We're eliminating the problems at the source. We've got a commitment to community, which we've had for decades before. And then you address social media. I've said this before. Don't tell people to avoid using it. They'll run to it. Instead, tell them when you find something on lead in drinking water, come to us and we'll explain the differences and why Flint isn't what's happening here in South Carolina. All right, my example, here's a school situation. Charlotte Water had to deal with this. They were relying on PFAS while they were dealing with this. 27 lead hits out of 58 schools tested. Okay, some schools had several locations inside the schools with hits. It was clearly the fixtures, not the water. So the water utility had a position of strength, if you will, on this. But they didn't run away from it and kind of say, okay, you're on your own school system and health departments. They worked together. There were concerns from parents and employees about the findings. Press coverage, it worked in Flint. It highlighted all the lead dangers before it got to how the school system was dealing with it. It talked about a lack of outreach, samples taken, that they, it accused the school system of not following up with results. Well, guess what? If they don't have a hit, they don't have to follow up with the results. It's a weakness that we'll talk about for the future in planning for this, that you put it out there regardless of what the information is. They did have a professor in the story say that significant exposure to these kids was unlikely, especially since they weren't drinking water when they first got into school in the morning, when you see the greatest likelihood of exposure. So Charlotte Water helped out with proactive information about compliance. Because of its work, drinking water was not seen as the cause. They had good ties with the schools, so they all worked together. The health department was essential. They provided essential data to calm parents down. They said, listen, if we get a lead, as children are tracked, and if they get lead in their blood, then we find out where they got exposed. And they didn't trace any of the exposures to kids in the area to the schools. And the school system jumped on the solution. They had an action plan in place and they put it in play. All right, they were going to protect public health. They provided perspective messaging about the exposure. Short-term solution, we're going to end the exposure. Okay, we're going to take out, we're going to keep people from drinking the water, and then we're going to swap out all the fixtures. Okay, as a result, there was a concern, but the scandal it didn't latch on for a long time. The press tried it a little bit. I knew the reporter on the story. He tried to get it in there. People didn't react to it as a scandal for a long period of time because the school system and the water system and the health department all work together. All right, our final bit on what we provide on this issue, here are the key stages, where we provide assistance either on our own or with 120. We create comm plans for all utilities of all sizes that cover interagency and external approaches, messages, materials, strategies, you name it, print and web materials, everything. And when it comes to the crisis response, we're instantly available. We're always on call. Everything across the board will be on it for you, and help you out. And our last example, I'll just show this because, go ahead, Erica. We talked 2 weeks ago about lead service line inventories. I had a client, Pinellas County, Florida, just decided to start inventory work without a plan and without any communications. This is what we did in about 48 hours. Erica was my backup to make sure, she was kind of my sounding board for this. But yeah, I did those graphics. I got to say that. So this is what we put out to Pinellas County. It's all, with all their field staff. We got it done in 48 hours so they could communicate about how they're already doing the lead service line inventory work. This is kind of the service we provide. And with that, I'll give it back to Erica.
All right. Lowell, you ready to take the stage, my man?
Oh, yes. Oh, yes.
All right.
Well, thank you. Yeah, I just want, before we talk about anything else, I just want to say these are great conversations, great questions coming in. Dana, we'll get to this one here. I think it's a great question and shows that we're thinking forward, which is just so refreshing and so exciting. But to Erica's point, right? We're not asking anyone to go test today or tomorrow. But again, I think to Mike's point, and the reason that we're partnered with him and Water PIO is this. All of this legislation encompasses so much, and it requires a lot of planning and thought. So really glad that we're all having this discussion today. And I'm kind of sad to say our last session is coming up here on Monday, May 17th at 9 a.m. We're going to look at the changes in the law to the tier site monitoring, and we'll also take a look and have Erica kind of dive deep on what the EPA is looking at as far as small systems of flexibility there in the law with corrosion control and different types of things that you can do. Before we kick over, Dana asks Erica and Mike, is there any concern that some schools, daycares, and parents won't understand why they're not being tested immediately? If the message is out there that says we need to check for possible issue, but waiting 5 years and you're only doing like 20%, should they be planning to do more than 20%? I think it's a great question, right? Are parents going to say, yeah, it's cool. You go ahead and do those 20% this year, and I guess I'll just stay over here and wait for 5 years for you guys to come and test my school.
Sounds like a good one for you to start with, Mike.
I was going to say you start first.
Oh.
This is a problem with the rule. I mean, sure, it's easy for me to say everybody test all your schools and daycares in the first year. It's not going to be possible for many people. And the reason why they put that in there, I believe, is because they realized the heavy lift that they were asking for some systems. And let's face it, there's a funding need as well. Imagine, requiring, if you don't have state funding helping you out, that it's all on your dime. You're going to have to explain why you make the selections you make with the school systems that you choose. And this is where actually 120's work kind of comes into it, because with their platform, I believe, and I'll leave it at this, Erica, for you, is they can help you triage your system where, maybe you've got schools and daycares in a part of the system where you've got a bigger concern for lead lines, and that might be your initial focus. But I wish I had an easy answer for you on this, but I don't. It is one of the problems that we have where parents are going to say, why'd you pick that school instead of my school, or that daycare instead of my daycare?
Yeah, I think, and Lowell's going to talk about the how we help part more, but I would say, Dana, I think you and I are our minds went the same place. It's one of the reasons why I brought that up kind of at the beginning, like, hey, if you've only got two, just knock them out. That's
Right.
what I would do, honestly.
Mm.
If you only, that's why, go use that zip code thing Charlie told you about, and just figure out, are we talking about a lot or a little? Because if you have the ability to knock it out, then what you can do is you can pair that with some of the messaging Mike said, and you can even use it to, increase trust.
Right.
Because what you're really going to be able to say is, hey, we could have waited, but we didn't
Right.
wait because this is a really important issue to us. So that's, again, this is one reason why talking about it now is important, because like Dana's saying, she's already thinking about, all right, well, if I can in 3 years, why wouldn't I just test them out right now? So for sure, if you can afford it, if you can do it, I would knock it out, and certainly we can help.
Right.
Absolutely. Carl, you just made my day. Will we have to test the schools and daycares once every 5 years, or is it a one-hit wonder like Billy Ray Cyrus?
Don't make me dance. Don't make
It's
me
a
dance.
I guess we're not counting as children then. This is a harsh room. No, yeah, Billy Ray Cyrus for sure. It's a one-hit wonder. Although we talked about this by request. If to continue the metaphor, if they want to keep hearing that hit, they can ask for another replay of it and have you come out and test. But the law only requires that you go out and do the testing once.
And there could be parental pressure to have the schools double checked and triple checked over the years. The parents could put pressure on a school or school system to keep it going, and they won't be able to say no to that.
They could. I do think it's
Well,
I think it's unlikely.
PR wise, they won't be able to say no to that.
Yeah, for sure. But I do, and we'll just have to see what happens. Again, I don't see a lot of evidence that parents are going to ask you to keep retesting. Maybe that will happen and you should be prepared, but that's not something that we've seen so far. But it's important. Mike is bringing up, these are about planning and contingencies.
Great questions. Thank you, Mike. Thank you, Erica. Yeah. So again, please join us on the 17th at 9 a.m. Let's keep these kind of conversations and these questions and answers going. As always, we're going to be working with Charlie, Jill, and the team there to give you guys resources. We will be getting the recordings out. Erica and her team are hard at work breaking down all the updates and things that they're hearing to try and bundle that up and get it out to you guys all as things go here. We are working on the LCRR self-evaluation tool, which we should be unveiling here in the coming weeks. So stay tuned for that. And then on 120water.com, we have a very, very robust library of webinars, recordings, downloadable tools, ebooks, things like that on a number of wide array of topics around the rule.
You got one more question, Noel. Sorry. I thought that was your wrapping up. You got one more question.
Yeah. Why would EPA not want high schools tested for lead and copper? Water can be consumed from the water fountains at basketball games by people of all ages. Great question.
So that is a great question. Why indeed? Yeah. There's not the health reason is that children are a higher risk population. I didn't say this before, but the reason that is that children have, they say it's a soft blood-brain barrier. So because of that, when a child drinks or consumes something with lead, it could be lead paint. That's actually, thought to be a more common source of lead poisoning in children, paint, not water. But anything they would ingest, it's like a super highway. It gets into the bloodstream, and because it's a soft blood-brain barrier, it goes straight to the brain, or more easily than it does for us. It can also adsorb to the bones, and it will stay in their bones for many years. Can get stuck in the gut, and then gastric acid will release it into their body. So the whole reason is high school versus elementary. They're trying to focus on the most at-risk population. Without breaking your pocketbook, without breaking the bank, is the thought. That said, again, those high schools can call you, and Mike has said this before, and I agree. I do think that will be common if you are already testing a a elementary school in the same district, if a parent has children that go to both schools and they get a set of results from one, I think that will be common. They'll say, hey, why? So you may end up having to test those populations. And I agree. In fact, sports facilities, those should be a primary target, because I mean, those folks are chugging the Gatorade the entire afternoon, right?
Yeah, absolutely. Thank you, Tammy. Great question. So, again, it's very, very, very good that we're all here having these conversations now. And I think, part of what I wanted to talk about is that, help is here. Erica, our co-founder, Megan, has been thinking about this for many, many years about how can we apply technology? How can we use different tools to accommodate and solve for these things that are being levied upon us, which again, it is a challenge, but it's a challenge for all the right reasons. We're trying to protect people. We're trying to protect kids. So just want everyone to know that, again, we've had some great conversations with a lot of systems since we announced the partnership. So let's keep those going. But 120Water essentially has built a solution to help with the sampling, with data management. And again, we talked about a little bit of our process, right? We're helping outsource and take the burden off of systems, whether it's with homeowners, which we talked about last time, but we've built a very robust process, like Erica said, to conduct statewide lead testing in schools programs. As she said, we're actually working with, I think, 7 states, so thousands of school systems, thousands of buildings. So, again, you can go ahead, Erica.
Okay, sorry.
So we've created an end-to-end lead and copper rule solution. We talked about how we can help you with lead service lines. We're partnered with Mike to help build out our public communications module and make sure that we have all the right messages going out in a timely manner with these new timelines and so forth. We can do not only the sampling, we can help you with filters, but today we're focused here on this school and daycare sampling protocol. And like I said, we have a tried and true process that we've been able to implement quite a bit. So it's a very similar process to how we do things with homeowners. You develop the sample plan inside of our software. You can order the kits to the different locations. And I'll show you a little bit here how this kind of breaks down and how you get a visual of all this. But process is the same, right? We work with our lab partner network to analyze those samples. Those go back into the system. We can track remediation. So, if we find issues inside the school, we can say, we can tag, just like we do with lead service line inventory. We can make a replacement plan, a remediation plan. Once those things are fixed, we can help you resample. And we do have a really cool, robust kind of public transparency capability where we can help you. And I've got a couple really good screenshots to share. So if you go to the next slide.
Yeah.
Hey,
sorry,
go ahead.
Sorry, no. I just wanted to pepper in, as you look through this, you might be like, well, hey, wait a minute. Erica didn't say I had to resample. What the heck is that? So there's some things that Lowell just talked about that you would not have to do. But the thing that I think is a little interesting about this is, at least with sorry to get into the salesy, I don't even mean to be salesy, but the thing that I think is interesting here is the facilities would have access to the software. And so they're working on it with you. And so it could be a nice leave behind for them. So some of these things like tracking what they removed and what they did, or resampling, that's something you essentially can leave behind to them without having to pay for it. And so I'm thinking about some of the advice that Mike gave us and what that could mean for messaging. So just wanted to call out that some of these capabilities are not about what you have to do. Sorry, Lowell.
Right. And I'll say this, that helps with the transparency of the schools or the daycares that have to deal with this. Whoever you're giving this access to, they can show people what they're doing on their end in cooperation with you. And that can provide a nice layer of defense, if you will, moving forward. So it helps them with transparency. Some people will say, oh, I don't want access to all this data. It's going to be publicly available. But honestly, you're giving them a tool that helps them get through this, and it'll be a big help.
Absolutely. No, great call out, Erica and Mike. I think what I'm trying to really illustrate is the depth and the expertise that we've kind of built in. We can go super deep. Obviously, we can help with the, I guess, what's required, but we could also, we've worked on some really thoughtful programs that go pretty far and deep and wide. So this is what a utility or the school administrators would be looking at inside of our software. So here you can see that there's 10 districts. We have over 75 buildings, facilities actually registered. Again, this is a example of a much larger, very large kind of statewide program. But again, everything in this module and what we've built goes down to the fixture level. So like on the home side of things, that's all down to the actual physical address. We take things down to the actual fixture location here in the school's platform. So, again, when it comes to reporting and communications, we've tried to be very thoughtful about what are the tools that you're going to need to make sure that people are educated, that you can pull and slice and dice the information, because this is a lot. Or, again, if you only have 1 or 2 schools and facilities, obviously, just wanting to show, that we have the capabilities and we have the solutions here that are going to hopefully make things a lot easier for you as you start to think about the crawl, walk, run of getting to compliance and thinking about this sort of thing. And then again, this is a really cool, so this is what we call our public transparency dashboard. Again, how can you communicate what you're finding? And parents, like Mike said, they're going to want to know. So we have built some capabilities in the solution to allow public access, so they can see, here at East J County Middle School, probably, a better screenshot would have been an elementary school. I'll make that note to Rory. But we tested 28 fixtures, we took 41 samples, we found 0 exceedances, and you can drill in. So again, trying to be as transparent, like Mike said, if you're open, honest, and you're up front and you're showing what you're doing, people and parents are going to say, you know what, this is a really, really good thing. And I'm glad that they're taking such a proactive approach. So all that said, it should have been, slide should have been updated, but let us know if you want to have a consultation with our team. We've got some of you have probably heard from Claire or Sam, Samantha, or Matt Bose. If you want to forward a slide, you can take a look at their faces, but we're here to help you through these conversations and questions. So please let us know if we can help out in any way. Eric has done a great job enabling our team. And again, we are here to help.